thank you for telling me you couldn't hear, for the webinar entitled Homeopathy. What is it? How can it possibly work? And how can it help my pet? First, we're going to talk about what homeopathy is. So homeopathy is a scientific theory of medicine developed in the early 1800s by Dr. Samuel Hahnemann. It's based on the principle that like cures like. And homeopathic remedies are made by a sophisticated process involving serial dilutions, which means one after the other, and a critical step called succussion, which is a vigorous shaking of the solution. This entire process is called potentization. And as you'll see later, it actually imparts energy to each successive potency. Remedies may be sourced from animal, metal, mineral, or plant. And homeopathy works with the body's natural healing efforts or symptoms rather than against them through suppression of symptoms as conventional medicine does. A brief history of homeopathy. It was first developed by Dr. Samuel Hahnemann, a German physician in the late 18th century. Hahnemann was not only an MD, but also a skilled chemist, botanist, and mineralogist, and he was fluent in 8 different languages. It was during his translation of a certain medical text that he questioned the idea of the author, suggesting that an herb called cinchona was able to treat malaria because of its bitterness. Hahnemann, having some knowledge of herbology, realized that many other herbs existed that were far more bitter than cinchona, but these other herbs were not useful in treating malaria. So he thought to himself that there must be some other reason why cinchona was so effective at treating malaria. And he began to experiment on himself, in which he started taking small amounts of cinchona at regular intervals. He found that within a short period, he developed the exact symptoms characteristic of malaria. And this was just the beginning for Hahnemann. He continued to experiment meticulously on himself and many volunteers with many different substances over the next few decades. Once he established the effects of various substances, he began treating the sick. While treating several children for scarlet fever using belladonna, Hahnemann discovered that if he diluted the substance greatly, he could lessen the exacerbation or worsening of symptoms prior to recovery. At this time, he also discovered that dilution combined with succussion or vigorous shaking appeared to make the medicine more effective. Hahnemann, however, was not the first person to bring forth the idea that like substances can cure like diseases. This idea was originally put forth by the man given credit as the father of medicine, Hippocrates, in around 400 BC. Well, over the next several decades, many physicians sought training in homeopathy from Hahnemann. Ironically, several of these doctors first set out to discredit homeopathy. 2 notable gentlemen who started with this goal are James Tyler Kent and Constantine Herring, both of whom went on to become skilled homeopathic doctors and produce writings and references on homeopathy. They've each written their own materia medica or remedy references. Homeopathic physicians also had much greater success than their allopathic counterparts, allopathic meaning conventional. During all of the recorded epidemics of the 18th and 19th centuries, including scarlet fever in the early 1800s, cholera in Europe in 1832, epidemics of dysentery and meningitis, yellow fever in Mississippi in 1853 and in New Orleans in 1878. During the cholera epidemic in Europe in the 1830s, more than 50% of those treated allopathically died, while only 20% or less of those treated homeopathically suffered the same fate. When yellow fever struck in the southern U.S. in the 1850s, allopathic doctors had a mortality or death rate of anywhere from 15 to 85%, whereas homeopathic doctors had only a 5 to 6% mortality rate. Around 1918, a pandemic, which is different than an epidemic. Epidemic is isolated to one area, pandemic is everywhere. A pandemic of influenza occurred in the U.S., and reports for allopathic treatment of 24,000 cases resulted in a mortality rate of 28%, while reports of homeopathic cases totaling 26,000 had a mortality rate of only 1%. There are many more reports on record, far too many to go into tonight. However, you can see that homeopathy has a long history of successful treatment of some very severe diseases. In fact, homeopathy was so successful in treatment of these outbreaks that in 1900, the U.S. Congress erected a national monument to Dr. Samuel Hahnemann. The monument's located at Scott Circle in Washington, D.C., and this is a picture of it. Just a little more about how homeopathy is different than allopathy. Both words are derived from Greek, homos meaning similar, allos meaning different, pathos means suffering. But homeopathy uses like substances to the disease, in other words, substances that in a healthy patient at high doses will actually cause the symptoms of the ill patient, while allopathy uses different substances with the main goal to simply suppress symptoms. Most allopathic drugs are an anti-something, anti-emetic, anti-inflammatory, etc. Homeopathy works with the body and helps symptoms to complete their process, their purpose, which is to restore balance. I sometimes think of this as like weather on the earth. Why do we have weather? We have weather to help restore balance. Weather systems help redistribute heat from the equator to the poles. If we were to in some way suppress the weather, the earth will become continually more and more out of balance. And this is how I think about symptoms of illness in homeopathy. Homeopathy, because it helps to reestablish balance, leaves the patient healthier than before and is actually able to cure disease in certain instances. Allopathy, on the other hand, does not leave the patient any healthier than before. It's not able to cure. You may argue that some people with cancer have been cured, but I would disagree. Because if you were able to microscopically examine all of their cells, I'm sure you'd find the cancer in there somewhere. It has simply been suppressed enough for their immune system to control it for a while, and eventually either it will come out again, even worse, with perhaps metastases, or some other very deep illness will occur, such as organ failure. As we just talked about, homeopathy helps to reestablish balance so that the afflicted patient can then heal themselves. The remedies do not act on the disease itself, regardless of the cause, viral, bacterial, fungal, autoimmune. They merely elicit a response or a counteraction by the body to fix the original problem or imbalance that caused the susceptibility to become ill. This in turn leaves the patient less susceptible to future illness. Hahnemann had many very different ideas about the cause of disease and the progression of it, particularly chronic diseases. Chronic is long-term, ongoing things such as rheumatism, also known as arthritis, mental diseases or psychoses, and certain private diseases such as those transmitted in brothels and such. These, you got to think back to the 1800s, and these things were a lot more common back then. Hahnemann observed that not all persons exposed to disease came down with it. His accurate view about why this occurred was that each person had a different susceptibility. Hahnemann was also able to determine that certain remedies, while they helped patients greatly, needed to be repeated multiple times. Hence, in his mind, they were not curative of chronic disease, but only settling an acute flare or perhaps treating an acute condition such as injury or infectious disease. In other words, they were not addressing the imbalance of the patient. These remedies were not acting deeply enough to actually fix the susceptibility. Over time, though, Hahnemann was able to differentiate which remedies tended to act to actually fix the chronic susceptibilities of these people. Hahnemann also observed that most disease appeared to begin with some sort of skin eruption, whether it was itching, pimples, scabs, or other lesions, which, if then suppressed by medications, would progress to more severe, more internal symptoms involving inner, more vital organs later on. Let's talk a little bit about how homeopathy may actually work. Of importance in understanding how homeopathic remedies can work is the concept of something called the Arndt-Schultz law. This law was discovered by a psychiatrist named Rudolf Arndt along with a pharmacologist named Hugo Schultz in the late 1800s. And as you can see by this graph, the law suggests that substances have very different effects at very low doses than at moderate or high doses. They can have a stimulatory effect at low doses, for instance, healing, and an inhibitory effect at moderate doses, such as suppression of symptoms. This has been shown for hundreds, if not thousands, of different substances. Nitroglycerin, for example. At homeopathic low doses, it is stimulatory for circulation in the heart, and at moderate doses, it suppresses and decreases blood pressure, and at higher doses, it can be lethal. Another concept that can help us understand how homeopathy works is the concept of hormesis. So the definition of hormesis is a process in which exposure to a low dose of a chemical agent or environmental factor that is damaging at higher doses induces an adaptive beneficial effect on the cell or organism. Hormesis has now been documented in over 8,000 different scientific studies of stressors called hormetins, which include many different drugs and chemicals, as well as physical and psychological stressors. In formal terminology, hormesis is a nonlinear, meaning it's not a straight line, adaptive dose-response relationship in which low, typically non-toxic doses stimulate, whereas higher doses of the same agent inhibit a particular effect. Principles of hormesis include the fact that all chemical substances will exhibit a toxic effect given a large enough dose. If you take enough salt, it can be toxic. But if you take enough water, it can be toxic, believe it or not. If the dose is low enough, even a highly toxic substance will cease to cause a harmful effect. And third, the toxic potency of a chemical is thus ultimately defined by the dose of the chemical that will produce a specific effect in a specific biological system. I want to briefly talk about nosodes. Some of you might be familiar with these, some not. Nosodes are remedies made from the dilution and succussion of diseased tissues. Nosodes are useful in the prevention of disease, but not typically in the treatment. To use them in this manner would be something called isopathy, which means treating the same disease with the same product. And it's really not been shown to be effective, much like a vaccine is not effective after the patient's already infected. But unlike vaccines, nosodes don't really provide long-term immunity, though the immunity can last for months. Nosodes are only effective in preventing infection, typically in the face of exposure, such as in epidemics, which we're going to see shortly. And they can be used in this manner, but are really not a true substitute for vaccines. Nosodes will not result in any disease as they are too small of a dose, unlike some vaccines, which even though the virus is weakened or killed, may sometimes result in symptoms of the disease, something that has been termed vaccinosis. Let's talk just briefly about leptospirosis epidemics in Cuba in 2007, because it's going to help us learn a little bit how nosodes are effective. So the island of Cuba gets hit with a lot of hurricanes and experiences a lot of flooding, and this creates an ideal situation for the spread of leptospirosis during certain times of year. This graph shows the average number of leptospirosis cases per head. IR stands for the interventional region, which includes 3 provinces that get the most flooding, and RC represents the rest of Cuba. This arrow represents an initial dose of leptospirosis nosode, which was used during this particular year because vaccine was unable to be produced quickly enough to help control this rapid outbreak. In the weeks following, you can see a rapid decline in cases. This was so successful and so much more cost-effective for the Cuban government. It cost about 1/5 of what it costs to produce the vaccine, that the following year, they used it again, and this is what happened to cases. So remember, in this graph, the IR is the solid line. Rest of Cuba is your dotted line. In this graph, look at how much lower the incidence of leptospirosis was. So Nosodes, for instance, would be effective for dogs going to stay in a kennel where they may be exposed to kennel cough, animals being brought into shelters where they may be exposed to distemper or parvovirus. The reason why so many of these diseases are spread so rapidly is that there's always some carriers who exhibit little to no symptoms. Kind of similar to Typhoid Mary. She never got sick, but she sickened many. So that's enough about nosodes. Let's address some of the myths out there regarding homeopathy, because there really is a tremendous amount of misinformation and incorrect assumptions being perpetuated. This is mainly due to fear and ignorance. Fear of the pharmaceutical companies for lost revenue if these treatments work, because they cannot be patented and therefore greatly inflated in price. And ignorance on the part of the medical community who either ignore the evidence or do not even bother to hear the ideas about how homeopathy may work. Myth number 1 is that homeopathic remedies are toxic. Believe it or not, I have actually had a client say when I recommended a homeopathic mercurius, I don't want to give my pet mercury, because she feared that there was risk of toxicity. So while many homeopathic substances actually are toxic at standard detectable doses, the amount of these substances have been so greatly reduced in homeopathic remedies they are completely safe and incapable of causing any symptoms of toxicity. In fact, they can reverse symptoms of toxicity when indicated. Additionally, in these low-dose homeopathic remedies, they also do not have any of the undesirable side effects seen with pharmaceuticals, which are always used in higher doses. Myth number 2 is that homeopathic remedies are so dilute, there's nothing in them, so they cannot possibly be effective. Until recently, there was not a lot of research to refute this myth, other than the obvious effects of treatment obtained by so many practitioners. Results are not enough to convince most, however, as conventional medicine teaches that everything is material, and if we cannot detect the material, then there's nothing in it. But new research involving quantum physics and electron microscopy, however, has shown that homeopathic remedies actually contain nanoparticles of the original substance. These nanoparticles are enough to cause an effect on an energetic level, but not necessarily a physical or material level. This is why there's no toxicity, but there can still be effect. Myth number 3, the effect of homeopathic remedies is nothing more than a placebo. Placebo means that the true medicine's not administered, but the patient may feel better simply because they believe the treatment will make them better. While this can sometimes occur through client interpretation that their pet is better or from wishful thinking, this type of effect isn't very probable with animals because they have no idea that treatment should make them feel better. It also cannot explain the mysterious disappearance or shrinkage of certain tumors through the use of homeopathy. And it can't explain the significantly better survival rates obtained during various epidemics in those treated with homeopathy. Is homeopathy energy medicine? Yes, it is. In a manner similar to other energy medicines such as Reiki and applied kinesiology, homeopathy is able to act on an energetic level. Albert Einstein was able to demonstrate that matter is simply another form of energy. E equals mc squared, right? A direct quote from Einstein states, "We may therefore regard matter as being constituted by the regions of space in which the energy field is extremely intense." This idea would explain a lot more than just homeopathy. It could help explain the paranormal as well as psychic energy and telekinesis. Through the process of potentization involving dilution and the critical succussion, each successive potency is imbued with more and more energy. And this can be seen in this Curlian photograph depicting mother tincture on the left, which is non-diluted full-strength herb, a 4C potency, second from left, a 15C potency, third from left, and a 30C potency on the right. The C potency is sometimes referred to as CH for Hahnemann, and the higher the number, the more diluted and succussed it is. So 30 is more diluted and succussed than 15, is more diluted and succussed than 4, etc. So you can clearly see the top row here actually is dilution with succussion or shaking by hand. The middle is dilution with mechanical succussion, and the bottom is dilution only. You can clearly see the difference in energy perceived by the Kirlian camera. One could kind of argue that mother tincture has similar energy to the 30C, so why bother diluting? But remember that dilution and succussion results in the elimination of side effects and toxicities, especially in those extremely sensitive individuals. For those of you not familiar with what Kirlian photography is a technique that involves the subject, or in this case, these dilutions, in direct contact with a film placed upon a metal plate charged with high voltage, high frequency electricity. So it's basically detecting these electromagnetic fields. Why is it so important to use the absolute right remedy? The right remedy must be chosen because it is the only one that completely matches your pet's imbalance and can therefore help them correct it. Finding the exact right remedy is tricky, however, because many remedies are very similar in action, and this is why it is so important to give as much detailed information about what is unique or different about your pet to the doctor. It will help with choosing the ideal remedy sooner rather than later. An incorrect remedy may result in one or more symptoms temporarily improving, something called palliation, but the symptoms will return. An incorrect remedy may also result in suppression of symptoms, which means the symptoms improve, but your pet does not feel any better. This is for the most part what conventional drugs do. They treat only the symptoms. The ideal remedy will first make your pet begin to feel better. They may be slightly perkier, wanting to play more, eat better, not be so irritable, etc. Symptoms will likely persist, but begin to get milder and eventually go away. Over time, previous symptoms from the past will likely return. This is a good sign that the body is healing. These symptoms should not be treated, and they should resolve within days to a week or so on their own. Also, as your pet's healing progresses, symptoms involving the most vital organs, brain, lung, heart, liver, etc., will improve first. Also, those symptoms involving the head will improve prior to those involving the torso, the limbs, the tail. Thus, healing occurs from within outwards and from the top down, or in dogs and cats' case, from the front backwards. If it's not the right remedy, your pet will tell us, perhaps by developing a new symptom or by not showing any improvement. Certain medications can interfere with homeopathic remedies being effective. So if it's not working, make sure the doctor knows everything that your pet's on. These are very important things, again, to let the doctor know. I just want to talk about, so we'll talk about what conditions can homeopathy treat. Almost anything, but it's especially good for allergies, acute allergic reactions and chronic allergies, trauma and bleeding, postoperative pain, sprains and strains, cancer, as long as it's not too advanced, chronic organ disease, arthritis, ear infections, any and all conditions made worse by vaccination. It's really the only thing that can help with this, because there is nothing that combats what a vaccine can sometimes do to the body, or what's called vaccinosis. Almost any condition that is ongoing can be helped with homeopathy. We're going to talk about a couple of success stories. Dory Ann is a 3-year-old female spayed Devon Rex cat. She's had ongoing eye problems ever since she was a kitten, and some behavioral fear and anxiety. Within several days after one dose of high-potency homeopathic Thuya, she's showing improvement in all symptoms. Luna is a 14-year-old female spayed Australian Shepherd mix. When she first came to see me, she could barely move or lift her head. She was not at all interested in eating. She was nauseated and vomiting and had zero energy. She was suffering from acute renal failure induced by a commonly used pain medication prescribed by another veterinarian. With the help of homeopathic Nux vomica, as well as ozone and UV blood therapy, she has shown a lot of improvement. Though she's still pretty weak and doesn't have a normal appetite, she's not nearly as bad as she was. Pally is a somewhere between 7 to 8-year-old female spayed spaniel mix belonging to one of my staff members, Jen. You may have seen Pally at the clinic. Anyway, back in February, Pally started to have severely increased thirst and urination, as well as decreased appetite and energy. She was leaking urine almost all the time. After discovering severe hypercalcemia, referral to the specialist revealed that Pally had cancer involving the thyroid and the nasal cavity. Radiation therapy was recommended as the only option. After being treated with homeopathic arsenicum album, along with ozone and UV blood therapy, Pally got her groove back. She has lots of energy and a good appetite. The thirst and urination are completely resolved, and her calcium has been normal for 3 months, whereas the specialist gave her an injection and said this will only help her calcium for 1 month. Lastly, or second to last, is Elvis. Elvis is a 5-year-old male-neutered domestic short-hair cat who suffered from severely inflamed gums and resorptive lesions of his teeth, where the teeth are getting eaten away below the gum line. Very painful. So after having 7 teeth removed in early April and getting homeopathic Mercurius vivis, Elvis is doing well and his mouth seems much more comfortable. The last case I'm going to talk about, I don't have a picture of, but Rebel is a 12-year-old male-neutered miniature poodle. He had an unusual red irritated area on the underside of his left upper eyelid. Even the ophthalmologist was stumped by this and recommended removal of nearly half of this poor dog's eyelid. Needless to say, Rebel's mom didn't want to do that. Within several weeks after one dose of high-potency Thuya, the abnormal area is much less red and less swollen. As you can see, each one of these patients needed a different remedy, though 2 of them did need Thuya. Since each patient is a unique individual, there's only one remedy that is ideal to treat them. And while the ideal remedy may change with time as the patient's imbalance changes, there will still be only one ideal remedy. Why is homeopathy so denigrated by conventional doctors? Fear. Fear of something they know little about. Big Pharma's influence. Big Pharma sponsors meetings and medical schools, and they're so afraid to lose money that in addition to suppressing homeopathy, they also try to suppress generic medications. The controversy over dilution, which is now being adequately refuted by science. Last couple slides, we're just going to talk about a few important remedies that can be useful in emergency situations. And the first one is Arnica montana. It is a plant-derived remedy, and it's either the whole plant or the root, and is very useful for any kind of traumatic injury. It can be useful for post-operative pain, if there's a lot of bruising. The next remedy is phosphorus. Phosphorus is a mineral remedy, and phosphorus can be used for acute, but also is one of these deeper acting chronic remedies. Phosphorus is very useful for bleeding, whether it's internal or external from wounds, bleeding tumors. It can be useful also in cases of diarrhea where the diarrhea smells really, really bad. It's useful for many other symptoms, too many to go into here, but those are pretty much the acute ones. And the third remedy is Apis mellifica. This one is an animal remedy, and they do use the whole bee, but it is extremely useful for bites and stings of insects, allergic reactions, especially any one of those that involve swelling of the face or the eyes, and something called urticaria, which is a fancy name for hives. All three of these remedies are in our homeopathic emergency kits, available for purchase at the clinic or by mail if you would like. If you're interested, you can call 815-929-9393 for more info about these neat little kits. So in conclusion, I just want to let you know homeopathy is effective when we get the right remedy, gentle with no side effects, long-lasting results with chronic treatment. However, sometimes with a chronic issue, if it is severe enough, an acute remedy may be prescribed first. The pet must then come back for follow-up for a chronic remedy, or their symptoms will return. And it's a great way to help your pet and potentially yourself. Are there any questions? You can just type in there. I hope that wasn't information overload. I think we might. So what was the remedy for allergies? Okay. There are actually lots of different remedies for allergies, but if the remedy for acute allergies, bites, stings, hives, is called APIS, A-P-I-S, and it's usually abbreviated APIS MEL, M-E-L. Homeopathy is very good for mast cell tumors. We would love to see your pet, or if we haven't already seen your pet, and I'd love to discuss with you. And that depends on what your pet's already on. We may need to make some alterations in their treatment protocol, but definitely useful for mast cell tumors. I'll wait a few more minutes in case does homeopathy work better than Chinese herbs? I would have to say yes. Being thoroughly trained and having spent a good deal of time and money training in Chinese herbs, I think Chinese herbs are great. I like homeopathy better because I feel like it really gets to the actual root of the problem. So yeah, I prefer homeopathy actually over Chinese herbs. I have a purring kitten on my lap here. All right, a few more minutes and then we'll finish up. It looks like we got one more typing. No, we decided not. If you have a question, think of a question afterwards, please just email us at info@naturalpetfamily.com if you think of something later, or even if you're watching this webinar on YouTube and you have a question for us, please just send us an email, info@naturalpetfamily.com. So someone's saying their granddog is on allergy shots and Prozac. Yeah, I can't just tell you a remedy, unfortunately, Kathy. We'd have to set up an appointment to see the patient. There's no way that I can guess at the proper remedy just from what you've told me here. I'd need to examine the patient and get all kinds of history. So please ask them to come and see us. We do also see patients in Naperville if Bourbonnais is too far. All right, so thank you very much, everyone, for joining us. I'm going to sign off. We will hopefully see you next time. July is going to be about feline medicine. So all you cat lovers, please join us. It's going to be the last Tuesday in July. Good night.